Hello, this is Carlos from Sunnyside Australia Health.
Hi, Carlos. This is Martin. Hi, everybody.
Martin.
We'll give it a few more minutes. Wes is gonna start us off, and then we'll go off from there.
Okay, everybody, can you all hear me on your phones?
Yes.
Okay.
Yes.
Yes.
Can you see the agenda on your screens?
Yes.
Yes.
Okay, great. Let's go ahead and get started. We're really excited to talk with you all today. Actually, before I get going, Martine, do we need to make introductions, or can we just go right into the presentation?
Either way, it's fine with me. We can do introductions, just, name an organization, if you want, and we can go from there.
I think I'm going to bypass.
Yeah, this is
ahead,
Lauren.
Denise.
I was going to suggest that we can invite all the attendees to put their name and organization in the chat box. We can bypass that since we only have 30 minutes.
Lauren, thank you. That sounds like a good idea, because I see about 60 plus callers on the line.
Oh, yeah.
So let's go ahead and get started. Again, I'm Wes Lucky. I'm the Deputy Director for the Greater Columbia, and we're happy to talk to you today about the dashboard tool that we put together. This comes from the CSI reporting portal, which your organizations load data up into. And there's been a long process that has led to this particular tool. I'd like to say that it's in its final form, but I believe that once you all get your hands on it and start running some queries, there may be some future revisions that we can apply to the dashboard to make it even better. So we began this process actually last year when our organization, first of all, knew that we had that richness of data in CSI, and we thought about trying to do some internal reporting. CSI, the vendor that produces the reporting portal, the landing page, and the dashboard, let us know that they had completed a dashboard for one of the other accountable communities of health and offered to work with us to create a dashboard for the GCACH. So that led into a process where we looked at a bunch of measures, and through some filtering and several meetings, we came down to a set of 12, actually 15 if you include some counters at the top of the dashboard, a set of about 15 measures that we thought were high priority. The tool itself is to help your organizations observe and profile your performance across these important milestone measures to allow you the ability to track performance over time, as we'll talk about when we use some of the filters in the center console. It'll also allow your organization to compare yourself against other organizations. If you're not speaking, could you please put your phone on mute? We're hearing some background there.
Now, the telemetry ones,
So it'll allow organizations the ability to track performance over time. It'll also allow your organization to compare your performance against other organizations.
I think we did, but without looking at it, I don't know for sure.
Could you please put your phone on mute?
So what I'm going to do with the telemetry documents, because they're all draft, and we're still working on
This
that.
is Lauren West. I'm working on finding who I need to mute.
You
Please, can you mute that?
copies of the draft.
Yes, working on it.
Sorry.
Okay, we should be good to go.
Okay. So again, to get back on track here, it'll allow your organization to compare performance against organizations that are a similar type, perhaps organizations that are a different type, and as well to track your performance across different cohorts or within the same cohort. Supplying this information on the structure and the process and the outcomes of the healthcare that you're delivering through the Greater Columbia Cares model, we believe will help reduce some variation in performance and potentially could lead to some best practices. So I'm going to let Lauren take it from here, and she can show us how to access the dashboard.
Yeah, Wes, so can you pull up the CSI portal, please?
Oh, wrong one.
Perfect. Okay, so as many of you, I'm sure, are familiar with the CSI landing page and the CSI dashboard. Once you log in, this is the screen you will see. Same as before, so you'll click on the Greater Columbia ACH community, and it will pull up this screen, which is the same as before. So you'll notice that there's now a tab titled Dashboard next to the calendar. Wes, can you put your cursor over it for us? And this is now live. So if you were to go into the CSI portal today, right now, you would see this. Everyone that has access to the CSI dashboard and is registered will have access to this dashboard. So if you click on it, this is the screen that will pull up, and this is the dashboard.
Once you guys are in here, I'll do a, I'll go over the different graphs that we see on here and the different, and how they differentiate. So I'll start at the very top with the number of sites. If you guys see on the top, there's 3 blue boxes. One's number of sites, number of active patients, and number of PCP/team panels. Those numbers on here are based on the selections that you guys have on the drop-down menus in the middle here. Depending on what quarter or what cohort, those numbers tend to change. So if we say, we only want to look at cohort 1, all of cohort 1, then on those 3 blue boxes, those numbers would change to reflect the number of sites, active patients, and number of teams within cohort 1, and then same for cohort 2, and then same for cohort 3. Or we can have them all combined. I want to see all of the sites together, the total number of sites, total number of patients, and total number of team panels. So that's on the very top that you guys see on there. And the numbers
Martine?
change. Yes.
Can you please describe where those numbers are being drawn from in the reporting portal?
Yep. So the numbers on here, the sites, active patients, and panels, that's being pulled from the milestone 2A1. If you guys remember, or if you're familiar with the milestones, that's the empanelment milestone. All that data is pulled from there. So if we enter a numerator and denominator backwards, that will throw off the data. So it's really important that when we are entering data into the portal, it's entered correctly. If not, then it throws off the percentages. It can show, you know, the empanelment for one quarter can be, you know, like more than 100%, which is impossible. And that tells us, hey, somebody did, you know, enter their data wrong. So we have to go back in and figure out who that was and fix it. So it's really important to you know, enter the data correctly. That way, when you guys enter the portal, you guys don't see, you know, something that doesn't make sense. But the top 3 blue boxes are pulled from the empanelment piece in milestone 2A1. And then moving on, so I'll start on the left-hand corner, on the left-hand side with the top 10 clinical quality metrics. This graph displays the frequency or the counts of the top 10 quality metrics that sites have selected for in milestone 5A2. These metrics are provided quarterly to us, at least 3 measures. So what this graph is adding all those measures up. So say for quarter 2, you know, if you go to quarter 2, just for cohort 1, it will give you the top 10 quality metrics for all of the cohort, or you can select only specific. Say you only want to know behavioral health or primary care, hospitals, whatever it is, you guys can filter that in the drop-down menu, and then it will give you the top 10 quality metrics for those selections that you guys have made depending on the quarter. And if you hover above the blue boxes on the top 10 quality metrics, it'll give you, you know, just a little bit more information on there, which is, you know, what it's showing on there. But this is taken, you know, overall the sites, depending on the cohort, it'll give you the top 10 quality metrics for that specific selection that you have made. Moving on to care management for high-risk patients. This is a time series graph that displays the overall percentage of high-risk patients identified by the practice through the risk stratification that you guys have been doing. Within each stratum, you know, sites are entering patients into those stratums. So, but this graph only reflects those high-risk patients over the time series, you know, quarter 1, quarter 2, quarter 3, quarter 4, and again, based on what selections you guys have made in the drop-down menus in the middle, it'll give you that data for whatever you have selected. And this is another piece of data, you know, that we need to make sure to enter correctly, because those percentages can be thrown off. You know, just like I mentioned with the empanelment example, it can be more than 100% if those numbers are entered, you know, wrong or backwards for the numerator and denominator. Moving on to the empanelment rates. This is, again, a time series graph that displays the overall percentage of active patients within the practice transformation sites that have been empaneled or identified within the clinic. EHR is being associated with a PCP or a team, a panel team that, you know, are, you know, the main care providers for the patient. So again, you know, the importance of entering the numerator and denominator, it's really important because it throws off those percentages. And again, this is pulled from 2A1. Yes, go ahead.
Sorry, this is Lauren. You have a question in the chat box from Kendra.
Oh.
She said, I assume the number of active patients could have duplicates. They could be seen by us and Lords, for example. She's from Catholic Charities.
Ideally, if they're, if they're behavioral health and, you know, primary care, yes, they can be some duplicate number of patients on there. because they can be impaneled for, say, for example, at LORD, for their primary care, and then they can be impaneled at Catholic Charities for behavioral health. So yes, they can be some of those duplicates on here. Okay, does that make sense, Kendra?
Yes, thank you.
Okay, perfect. And then moving on down to the middle row, we'll start with the top 5 risk stratification methods. This graph displays the frequency distribution of the top 5 risk stratification methodologies or data types that have been selected to risk stratify your patient population. And this data is pulled from 2A.2.A, risk stratification methodology and types. If you guys are familiar with the milestones, that's a list of different different options that you guys can select to risk stratify your patients, where you will identify, those high-risk patients that tie back to the care management graph that we saw previously. And then care coordination options. This is a graph displays the frequency distribution or count of the care coordination options for collaboration, monitoring, and follow-up. The frequency distribution includes, there's 3 selections on there, which are track the % of patients with ED visits who receive follow-up contact within 1 week of discharge. That's one of the options. The other is contact at least 75% of patients who were hospitalized in target hospitals within 72 hours of discharge. And option C, creating or enacting care compacts or collaborative agreements with at least 2 groups of high volume specialists in different specialties. And that's to improve the coordination and transition of care of your patients. So this shows the percentage of those follow-ups depending on the selection that was made by the site. Yes.
So just to clarify, these are not percentages. These are actually counts. There was some confusion about this before, and we've clarified that CSI is only putting in the raw number. We're not putting percentages into this particular chart.
Oh, got it. And this data is pulled from milestone 6A1, which is the care coordination milestone for practice transformation. And then we move on to the behavioral health integration models. That's milestone 2B1. There's for cohort 1, there was 3 options available for you guys, which were the BREE Collaborative, Co-location of Primary Care and Behavioral Health, Ames University, from the University of Washington Collaborative Care Model. For cohort 2, they had those 3 options, plus we added in the other option for them because they had a little bit more flexibility as far as the type of integration that they could do. They could do behavioral health with substance use disorder or substance use disorder with behavioral health integrated, or primary care into behavioral health or behavioral health into primary care. So there was some flexibility, as well as telehealth or integrating into school systems. So when you hover over the bars, it tells you, the rates or the times of the models, how many times the models were selected, for each site. And then the other, it'll just display the other because that was a free text box. So it's hard to pull that data on here. So we just have it as other. But those are the types of integrations that our sites have done over the course of practice transformation. And again, it depends on the quarters. If you guys, say, hey, I want to see quarter 1 for cohort 1, that, and then you say, I want to look at it again, but quarter 3, the bars can change, the data can change, because they can be integrating or changing models throughout the course of practice transformation. So they can start with the pre-collaborative, but say, hey, we want to go to co-location, and that happens in quarter 3, then that would show in quarter 3 that, site 024, which is the code for, the identification of the site, transition into co-location from Bree Collaborative, which was Q1. So that can change throughout time. And this is being pulled again for milestone 2B1. And then we move on to medication management services. This graph displays the frequency distribution of different opioid prescribing guidelines being used by the practice and consists of the following options. There's the BRIE guidelines for prescribing opiates for pain, CDC guidelines, AMDG guidelines, and provider use of other guidelines for prescribing opioids pain, opioids for pain, and then that was a free text box as well. So that was, and those are that's what this graph is displaying. And again, the data can change on there, the graph, because they can start with one of the guidelines, but say, hey, we want to move more towards CDC prescribing guidelines, so that can change as well, depending on the quarters. And then this is pulled from milestone 2B3.A.2. There's a list of options on there that you guys can select from. And then we move on to follow-up within 1 week of ED discharge. This graph displays the percentage of patients discharged from target ED hospitals who received a follow-up contact from the Practice Transformation Organization within 1 week of ED discharge. And then this percentage is calculated as the sum of the numbers of patients that receive follow-up within 1 week of contact after ED discharge for all sites divided by the sum of the denominator, which is the total number of patients that went to the ED. And then this data is pulled from milestone 6A1 and then also 4A1 option A for the care coordination across the medical neighborhood, follow-up contact patient within 1 week of ED discharge. So there's that graph on there. And then we have another graph for follow-up within 72 hours of hospital discharge. The data that's displayed on here that gets pulled from milestone 6A1 and 4B1 is the same as the previous graph that we saw. They're pulling the denominator and numerator of the patients that went to that were hospitalized, and then out of those total number of patients that you identified that were hospitalized, how many of those received follow-up within 72 hours of discharge. So that's what this graph is displaying here. And then we go on to high referral community partners. This graph displays the frequency distribution or count of the top 5 specialists of high referral community partners, with which they have some type of referral agreement, or they refer them to those sites. So this is again a count of the number of agreements that are being made, and that helps with the coordination across the medical neighborhood. And again, this is being pulled from 6A1 and 4C.1. This data is being pulled from there. And then we move on to identifying patients needing integrated care. This graph displays the frequency distribution of the methods the Practice Transformation Organization is using to identify patients needing integrated behavioral health services. And here is just a selection. So they have the options of use of risk stratification methodology, positive screen, the presence of a specific diagnosis, inability to reach goals in management of chronic conditions, or any other. So this data is being pulled from milestone 2B1, question number 6, which is in the bidirectional integration of behavioral health. And it's a selection. So this data for this graph is being pulled from that specific milestone. And then lastly, we have the behavioral health integration assessment tools. These are there's some options on there. The AIM-centered patient-centered integrated behavioral health care principles and tasks, the Integration Academy self-assessment checklist, the MHAF, Main Health Access Foundation, and the patient-centered medical home assessment, PCMHA, and then any other. For us, we do the Main Health Access Foundation, MHAF, and PCMHA. And this graph is going to change as far as the numbers that are being reported on here, because the assessments that were completed say Q1 of year 1 of practice transformation, that data carried over to Q2, 3, 4, and then also to Q1 of this year. So I'm gonna have to go back and see, and I'm in that process of changing when those assessments were done, so we can get a more accurate number of the number of MEHAF and PCMHs that we have done with the organizations that we are contracting with.
Martine, thank you very much. Why don't we stop there for a minute to see what questions people might have.
They might be muted, Wes.
Pardon me?
I said they might be muted and won't be able to ask questions. So I think,
yes, they
Lauren,
are muted.
Yeah.
They are muted. I haven't seen any questions in the chat box. I will make sure to interrupt if any pop up.
Okay, perfect.
Okay, great. So just to inform people about the center selectors, this area of the dashboard is called the console. Within the console, there are 4 ways to filter the data. I'm going to pull something up here just to clarify.
Wes, I'd like to interrupt you really quick. Rhonda had a question. She said, isn't there a way to identify our organization and how we compare to others in our cohort?
We are going to go through that right now. So everybody should understand which cohort they're in. With this selection here, individuals can come in and select a specific cohort. Just as a refresher, this chart here tells when cohort started. Cohort 1 began in January of last year. Cohort 2, which are primarily the behavioral health agencies, began in July. And then cohort 3, which is the latest cohort, began in January of this year. So you can see here the performance year and quarter depends on where you started. It's not based on calendar year and quarter. So this is very important. So here, for individuals who want to select a cohort, the first thing you do is to unselect everything by clicking on the select all, and then click on cohort 1. And let's say we want to keep everybody who's in cohort 1 across all the practice transformation quarters and years that are in the dashboard. Click update. Oh boy. I may be getting kicked out here. Okay, I'm sorry, I have to come back in.
While you get back in, Les, we had another question from Penny. She said, we haven't been given our site number yet. When are these being sent out?
Yeah, we'll be actually, let me talk about that really quick before I get into the selectors. So every organization will be given a site code for their specific site, not the organization level, but the site level. The codes look like this. They're a 3-digit code. It'll be sent to you so you understand which one of your sites corresponds to a particular code. Martine will be sending out an email blast today and tomorrow to each of the sites. So you should be getting your site number before the end of day tomorrow. And if you don't, or you have questions about your site code once you receive it, please respond back to Martine. So again here, as we select a cohort, we unselect all. If we select cohort 1 and then update, takes a minute for it to update. Now all the charts and graphs have been updated to cohort 1. You can see here the number of sites that correspond to cohort 1 are 37. Is that correct, Martine? Are there 37 in cohort 1?
I think he's
Martine?
muted. Martine? Let me unmute him.
Sorry, I was muted. What was that, Wes?
Are there 37 sites in cohort 1?
No, that is wrong.
Okay, so we'll have to figure out why this isn't displaying correctly. It should have the number of sites that are tied to cohort 1. As we said, we're sort of going through and doing some troubleshooting. Ideally, it would have the number of sites, the total number of patients, and the total number of PCP or team panels that correspond to that cohort. Within that, there are several different organization types. If you wanted to further refine this and look at just primary care, we would select all to deselect, select primary care, and then update it again, and you'll get a further narrowing. To show primary care sites and the results for those. Now, we're working on a feature here to reset everything. Unfortunately, if you want to go back to the base, you have to go through each one of these and select them again, or select all to include everything. A quicker way of doing this is to simply refresh the page on your computer through the URL or through the browser, and it should bring up the dashboard in its default state that has everything selected. Now, let's assume, and this is another issue where you actually have to select all for the sites, and this is another issue that we're working through with CSI. But let's say you come through here and you are site 007 and you wanted to see the performance of just your organization. You unselect by selecting all, click on 007, and then update. And this is the performance for organization 007. So if we wanted to further refine this down for P1Q1, which is the first quarter of the first year of practice transformation for that organization. Again, this is a little confusing why data is not coming up here. So we had troubleshoot this before it was launched. Is anybody from CSI on the call?
Hi, Wes. Jeff here. We are.
Jeff, do you know what's going on with this?
Nope. We will take a look. I don't know if you selected a site that may not have that data, but we can double check.
Okay. So we have a call with CSI tomorrow morning where we're going to work through some of these issues. So I apologize if this is not fully ready for prime time. So again, to get back to the default state, selecting that will bring back the full number of sites, cohorts, time period, and site types. So organizations are also affiliated with a particular type, hospitals or hospital, behavioral health. It's pretty intuitive or instinctive in terms of what type you are or your site is tied to. Other includes a bunch of smaller sites, such as our skilled nursing facilities, and some other organizations where the numbers are very small. Those are all grouped into the other category. So, are there any questions about that feature, those features?
Wes, this is Lauren. It looks like we're running over a bit on time. I want to be respectful of everyone's time. But just to close out, we do have a user's guide that we are in the process of finalizing to cover all of the information we went over today. And we will be sending that out hopefully in the next week or so. So be on the lookout for that. We'll be sending that to all of those that are registered in the CSI portal. And if you have any questions in the meantime about the dashboard, please feel free to reach out to your Practice Transformation Navigator or anyone else in the GCACH team, and we'll make sure to get your questions answered. Thank you guys for joining us, and sorry we went over a little bit. We know it was a lot of information, but we will have that user guide out shortly.
Thank you, everybody.